Good morning. I'm Rod Garvin, SVP of Talent Insights for the Charlotte Regional Business Alliance. I also serve as Executive Director of the Alliance Foundation. We all know the disruptive impact that COVID-19 is having on our community as well as our country. We're getting more data every day in terms of the health impacts as well as the economic impact. This week, was an opportunity to really have a conversation on how the coronavirus is affecting the Black community. The Harvey B. Gantt Center, as well as the Levine Museum, had virtual conversations on that very topic. And Charlotte Agenda published a story sharing some personal stories as well as statistics on how the Black community is being affected. I'm excited to have two special guests today. Subject matter experts in the medical field. We have Dr. Emily Haynes Cooper, who is the medical director of Atrium Health's Biddle Point facility. We also have Dr. Jerome Williams, who serves as Senior Vice President of Consumer Engagement and Community Health at Novant Health. He also happens to serve on the Alliance Foundation board and is our Healthy CLT co-chair. Doctors, before we get started, just wanted to give you all an opportunity to share any important updates. I know things are changing every day, but wanted to allow you to share what's happening from your perspectives within your organizations and the work that we do. Whatever you think is important for us to know in this moment.
I guess
I'll let you get started, Dr. Cooper.
Thank you so much for inviting me to this discussion and taking the time to have us talk about this. It's really just uncertain times, and there's a lot of stress around it. As far as Atrium Health, my clinic actually is one of the community clinics for Atrium Health. So the population that we service is underserved. There either is no insurance or underinsurance. So that's the population that I primarily work with. But from a larger standpoint, Atrium Health made a lot of changes probably about a month ago, the beginning of March, where we're doing things like really looking at our schedules to see, okay, do these patients need to come in? If we have patients that need to come in, we are trying to space those visits out. We're doing a lot more phone visits. So the way that primary care physicians certainly have practiced, in the last 30 years, just kind of ground to a halt approximately a month ago. So there were a lot of changes we had to make quickly. It's already been in the news that there were elective surgeries that were put on hold. There were changes to the visitation policy, which has been similar to other places where we really had to restrict the number of visitors that a patient could bring in with them. So it's been a big upheaval that we pretty much weathered. Of course, there's been a lot of stress among the staff and our patients, but keeping things level and doing the best that we can to serve our patients. That's kind of a high-level overview of what we've been doing over the past 6 weeks or so.
Yeah, thank you for having
Williams.
Yeah, thank you, Rod, for having me on this program. And I would have to echo exactly what Dr. Cooper said. Similar to Atrium, Novant is going through similar changes. One thing I'd like to add is that from the very beginning, there's been a collaborative relationship between Novant, Atrium, and Public Health, Mecklenburg County, in order to address this pandemic in a collective fashion to serve our communities. And what does that look like? Really calls and collaborative engagements on a daily basis from our CEOs all the way down to our operating teams, looking at bed capacity, vent capacity, PPE, the health of our employees, all of that in a collective fashion, because this is impacting our community broadly, and a collective action is needed. With that said, some of the activities that we've engaged in with the county, with Atrium, and with the community, the biggest one is really our stay at home, right? Stay at home initiative, which has definitely flattened the curve. Why is that important? There was initial talks about opening up a a field hospital, a combined field hospital between Atrium and Novant. And because of flattening of the curve, and as Dr. Cooper mentioned, the canceling or postponing of elective surgeries and things of that nature have created capacity within our systems to care for not only our COVID-19 patients, but patients requiring urgent and emergent care. And so at this particular time, it appears to be enough capacity in our healthcare systems to care for the patients, and now really begin to look down the line and see what our community would look like as the economy opens back up again. What does that do for new cases? What does that do for the potential increase in COVID-19 patients? So a lot of ongoing activity to care for the COVID-19 patients, and just as importantly, how do we open up our economy in a safe way?
Thank you for those updates. And, I can definitely speak on behalf of the Alliance and say, we know that we wouldn't be where we are, and that's moving in the right direction, flattening the curve, as you said. It's really because we have two of the best healthcare systems in the country, if not the world. So we appreciate what you and your organizations are doing. Getting into the Black community specifically as it relates to COVID-19, African Americans account for about half of Mecklenburg County coronavirus deaths and almost 49% of overall cases, yet we only make up 32.9% of the county's population. That's a disparity. We know that there's disparities across many health variables, as well as other indicators, socioeconomic across our society. So it's a bigger issue. This is symptomatic of that, but really wanted to get your perspective on what you think some of those driving factors are and the disparities we're seeing right now as it relates to COVID-19. Dr. Cooper, you want to get us started on that?
Sure. I think even in your introduction, you kind of hit the nail on the head that historically Black Americans have been socially and economically disadvantaged. And one of the ways in which this presents an issue is the jobs that they hold. Like you said, that there are higher numbers of Black Americans who are doing these essential jobs, like working in the grocery store, the bus drivers, and other things where they're unable to do remote work, unlike a higher number of white Americans and other races who are able to stay at home. Another factor that we see is the area in which they live. If you have more Black Americans in more densely populated metro areas, we know that there are issues with housing. So where they're not in homes, if I have a 3-bedroom home, I can socially distance myself from my daughter if I'm sick. But if you have 7 people living in a 2-bedroom apartment and one of the family members has COVID or is leaving the home to go to work and potentially bringing it back in, they have nowhere to socially distance. The next issue is we're more likely to have serious and chronic medical problems. We know that in Black Americans, there's a higher number of people with diabetes, with heart disease, with chronic kidney disease, and we know that these conditions make COVID-19 worse for them. So these are some of the things that cause the higher number of deaths from COVID-19, what we're seeing at higher numbers of people who may have it, just because these other factors are contributing to that.
Yeah, and in addition to what Dr. Cooper stated, completely agree, spot on. In addition to that, there's obviously a historical distrust of the healthcare system when it comes to communities of color.
Absolutely.
And interestingly, Rod, I suspect the number of folks that have died from COVID-19 is actually a higher number. I don't think we're counting the folks that stayed at home because of whatever perceived or real distrust they may have of the system, and unfortunately have passed away at home. And so those numbers are really not calculated or tabulated in the statistics that you mentioned. I'd also like to reframe this discussion just a little bit, in that we understand that 80% of chronic medical illnesses have nothing to do with biology or genetics, but has more to do with what we call the social determinants of health that everyone on this call is well aware of. Housing insecurities, food insecurities, transportation insecurities, lack of upward mobility, things of that nature. And so when you look at those variables, while ultimately it all leads to adverse health outcomes, okay, really the discussion in my viewpoint is not only about the healthcare system, but society, right? Really society. What our healthcare systems can do and what we're doing at Novant Health is creating a platform for these discussions. We're not subject matter experts in housing. We're not subject matter experts in food insecurity. We're not subject matter experts in upward mobility, but we do have a platform, a responsibility as an anchor institution in our communities to at least exhibit adaptive leadership in those areas in order to bring about the changes that we need. And so I would reframe the conversation not only with healthcare, but healthcare leaders, political leaders, business leaders, to create a conversation as to how do we address those disparate or inequity, I should say, those inequities in many facets of life. Some of them are regulatory policy driven, some are structural inequities. How do we address those in a comprehensive fashion to improve the health of all communities? And what do I say comprehensive fashion? Well, if you address food insecurity, but you don't have a home, you really haven't done a whole lot. If you address access to healthcare by opening up clinics such as the Michael Jordan Clinic on Freedom Drive, Dr. Cooper mentioned the Biddle Point Clinic where she works. That's great. We need access. We need more access. But if you have access and no food, you really haven't improved the situation. So I like to speak to the comprehensive, holistic way of addressing the challenges that communities of color have experienced, continue to experience, and really just reared its ugly head once again during COVID-19. But the underlying issues have always been there.
Absolutely.
Yeah, I think you both have spoken to the complexity of the issue. You know, there's so many variables, you know, overall access to healthcare, housing, food, transportation, and mobility. And it really ties into this broader economic mobility and opportunity challenge that we've been facing as a community, and health is at the center of that. What kind of, you know, creative or innovative measures do you think we can advance to address healthcare as a whole, but particularly for vulnerable communities such as the African American communities? I know digital care has increased significantly during this time as a way of helping to maintain social distancing and limiting the exposure of folks to the virus. Is digital and or other measures a way of closing some of the disparities that we're talking about? Dr. Cooper?
Well, I really think that really just continues part of what Dr. Williams was just talking about with the digital. We know that many children don't have access to a computer, even though that there were things done to improve Wi-Fi availability. Well, if you don't have access to a computer, it's useless. You also have to have a parent who's interested in taking the time to sit with the child and really become the teacher and work with teachers. And then you have to have a parent who kind of understands how to get it going. You know, I was having issues with Zoom before we started this, so I kind of had to be able to figure it out on my own. So there's that piece. And then, you know, the concern, I was talking with the teacher about, you know, well, I saw an article that they're just going to pass the children along. So the kids who were having trouble, does that mean they're just going to continue to be passed along where they haven't understood or haven't done the work or whatever, or they're hungry, so they can't understand it anyway? So I really think it's the broader look at these issues that's really going to get us there. But as far as the digital age, absolutely, we definitely need to have a more robust digital platform. I know part of what Atrium has done is to not just have the virtual video visits, we're doing a lot of phone visits, but of course then that becomes an issue because the burner phone number that we had last month for a patient is not the current burner phone number. So it is a really, really complex issue that is going to require everyone taking part in this.
So, the simple question, Rod, is telehealth, virtual health, another access point into historically excluded communities? Short answer, yes. Obviously, telehealth, virtual health is very, very important. We, in addition to our phone calls and virtual health, we have a partnership with Tidal Care. Tidal Care is a device which is a virtual health telehealth device where not only obviously you can have a face-to-face conversation with a clinician, but we can do also a limited physical exam. We can listen to heart sounds and can be transmitted via telehealth platform to the provider. We can do throat exams, ear exams, measure temperatures, things of that nature. That's called our Taito home care product. However, to Dr. Cooper's point, that's all great. It's all wonderful. Great technology. Rod, I could, with the Tidal Care device, I could, examine your throat right now online if you had a Tidal Care device. However, to Dr. Cooper's point, you don't have a computer, you don't have Wi-Fi, you don't have internet. It doesn't create increased access points. What I would really, like to see, and this is a long-term, we're talking about long-term, right? With short-term tactics, we have intermediate, kind of tactics and long-term. Long-term, what we really need to better understand as a society and as a community, and I think this would resonate with you, Rod, in your position over at the Alliance, is that there are two foundational elements to strong societies, okay? I don't care what religion, what culture, what ethnicity, doesn't matter. Education and health. If you have an educated society, and you can define that in many different ways, in a healthy society, then typically you have societies that are strong, okay? Without a healthy and educated society, Rod, you can't find gainful employment, right? There are no opportunities. One of your focus areas is workforce, I believe, in workforce development. And we have to understand better and apply activities to engage at an early age, education and workforce development. For some, that may be college and university. For others, it may be a trade program or trade school. Doesn't matter how you slice it or dice it. Education and health go hand in hand. And so from a foundational level, once again, as an individual gets older, you can create access points and things of that nature. But on a foundational level, if there are no opportunities for upward mobility, education, right, then we're going to continue to deal with these challenges chronically, and then acutely we'll have spikes when we have pandemics or some other insult that descends upon our communities. So I would really like to see a foundational approach as it relates to educating, and some of that's already going on with early childhood education and things of that, activities in that area.
Dr. Williams, I'd like to build on that point and maybe switch just a little bit in terms of thinking about education and the development of our future healthcare workforce. We know there's a lot of changes right now. There's discussions about what are essential or non-essential healthcare workers. McKinsey's done some really extensive research on how COVID-19 is impacting our whole economy, but they've also done some research around impacts in the Black community in particular. We know that the Black community is overrepresented in 9 of what are considered 10 essential positions, which tend to contact exposure to the virus. Black Americans make up 39% of psychiatric aides, 38% of orderlies, and 33% of nursing assistants. On the downside, there's this exposure to the virus, but, African Americans are on the front lines. They're a part of the workforce that you all are a part of serving, and that's positive. And we know that there's economic mobility in healthcare. So I'm curious what you all think about that, because we're still going to need to build our healthcare workforce. We're still going to need medical professionals. How should we be advising young people, children and students of color and others as it relates to pursuing healthcare in what will be a post-pandemic world? And the reality is this won't be the last pandemic that we face. So really interested to get your perspective on that.
So healthcare is a noble calling, okay? It's not just a profession, it's a noble calling. Not everyone can be a healthcare provider. Not everyone is willing to say, I'm going to don my personal protective equipment, leave the safety of my household, leave the safety of your 4-year-old beautiful babies to go into an environment, right? An environment where you're really at war with a virus in order to take care of patients. That takes a special individual. And so those types of individuals will always be needed, whether they're the frontline worker as a community health worker, which we can talk a little bit more about as well. I want to talk a little bit about community health worker, all the way up to CEOs of healthcare systems. They're in it because of the calling, okay? Now that said, when I look at the exposure, let's just say of healthcare workers, I'm not going to speak just yet on frontline workers such as grocery workers and things of that nature. But if you look at healthcare and those in healthcare system, and that can include custodial work, cafeteria workers, et cetera, there needs to be and should be and has been the ability to protect those workers, okay? A PPE, personal protective equipment, okay? There has been, and I'm not saying anything that all on this call are not aware of, from the top down in terms of leadership across the country, there's been a failure in that regard of leadership from federal level down, as it relates to the response, as it relates to equipment, as it relates to the needs of the frontline workers, right? And so while I would never dissuade anyone from going in healthcare because it's a calling, we must, as healthcare professionals and institutions, must protect our workforce, right? Have them equipped to go into battle. I hate to use war terms, but that's what it's really about. How are they equipped to go into battle to fight this virus on behalf of the community? So I don't have a problem with folks of color pursuing healthcare careers, but we just must make sure that their frontline workers are protected.
I totally agree. The only other thing I would add is, there is still a place for encouraging our children to go into the STEM type programs. They're from being an engineer, they're engineers behind developing ventilator machines and other creations that we've seen. We still need nurses, and again, with the front line and them having the equipment that they need to properly and safely care for our patients. We still need respiratory therapists. We still need radiology techs. So we still need all of those other pieces of our healthcare force. But just as Dr. Williams alluded to earlier, we need public health. A robust public health program. As he said, the response has been lacking. So we still need those community health workers. We still need virologists who can study, viruses and, bacteria and other things. We need epidemiologists and statisticians. So there's a wide array of careers that young people can pursue that are healthcare adjacent. Like he said, it is a calling, that I can leave home and leave my baby girl with hubby, but we still need those people who are adjacent supporting the work that we do on the front line, on top of having the appropriate protection to take care of our patients.
I'd like to piggyback on what Dr. Cooper said, all of those careers, those wonderful careers that she outlined, when I say we, the African American community, are underrepresented in those amazing careers.
Mm-hmm.
You know, when I get, I'm sure Dr. Cooper will say the same thing, when I go out and speak to schools and youth and things of that nature, look, I don't dissuade people from becoming a physician, but I also say to them, look, there are many other careers outside of becoming a physician. There are many 2-year programs that individuals can engage in at CPCC, cath lab techs, respiratory techs, radiology techs. Dr. Cooper outlined a whole bunch of them. And we are so underrepresented in those well-paying, growing medical fields. So how do we create a pipeline, right, for those individuals, whether it be at the elementary, middle school, or high school level, to feed into some of those very important and crucial careers. Without respiratory therapists, none of those ventilators that are running in the hospital with COVID-19 patients would be able to be manned. And that's a separate career pathway from a nurse, physician, etc.
Yep, absolutely.
Well said. You know, we have to think about healthcare careers broadly. You know, obviously, you know, those who are in nursing and other areas of healthcare service, working directly with patients, but you spoke to the technology, the research, the laboratory, many different facets. It's a big industry with a lot of different needs. You know, we at the Alliance have been talking about and are seeking to advance, as you know, Dr. Williams, a careers campaign that could really, you know, raise awareness around these career paths that align with industries in our region that lead to economic mobility. I'll put in a plug for the foundation. If you want to contribute to that cause, you can go to charlotteregion.com/foundation and make a donation today. First time I've made a public request, but I think it's appropriate given where we're at. You know, something else we're proud of is the way that our manufacturers have stepped up here in the Charlotte region and nationally to help with the personal protection equipment, the PPEs that you all speak of. You know, so we're trying to highlight those, you know, positive stories. You know, I can't speak to the issue of leadership in the way that you did, Dr. Williams, but I will say that you know, leadership will fill vacuums where it's needed. And we're glad to see some great local leadership as well as in our state right now. To close, I think we could probably keep this conversation going.
A couple of days, Ron, at least.
I can hear Natalie in my ear, our producer, saying we need to wrap up. So I'll just let you all, you know, have a final word. Again, I started with talking about how the strength of our healthcare systems is what gives us hope. The collaboration between the private sector and the public sector. But what would you all, you know, like to see more of? You know, how can we come together to address this current crisis and pandemic? I think we've seen some positive strides, but what can we do to ensure that we make it to the other side in a better place than we are now?
First and foremost, I'd like to say that the activities of working with our historically excluded communities predated COVID-19 and will post-date COVID-19. So the activities that Novant has been engaged in as it relates to upward mobility, food insecurities, transportation insecurities, focus on social determinants of health, that started increasing access, that started years ago and will need to continue because these are chronic problems. That's number one. And number two, I believe that it takes deep partnerships, not just partnerships with Atrium and the One Charlotte Health Alliance, which we're proud to be part of, but also partnerships with other organizations, grassroots organizations, faith-based organizations in the community, because as I mentioned earlier, this is a comprehensive, it requires a comprehensive solution to these challenges, and that requires deep, trusting partnerships deeply rooted throughout the community, and look forward to continuing to develop those partnerships.
Yep, I totally agree. And Dr. Williams already mentioned the One Charlotte Health Alliance, which is the joint venture with Novant and Atrium and several other entities. And that's important. And that work started before COVID-19. Here at Biddle Point, we already have a clinic that is different than your typical primary care office. We have a social worker. We have our system's first food pharmacy. So we're already looking at ways to help people navigate some of those social determinants of health. And that needs to continue. Just as Dr. Williams mentioned earlier, on a larger scale, because we can't, just fix the food issue, but we're not helping them fix the financial issue where you have a patient who may be choosing their rent and they can't pay for their medication. So we need to have robust programming and have it continue. We know that, Atrium and Novant were in the business of healthcare, but really at the heart of it, the goal is to improve the health of our patients, to improve the health of our community, and that needs to stay the primary goal over the business enterprise.
Thanks to both of you. Thanks for your time, especially in the midst of everything you're dealing with day to day. Our prayers, our thoughts, our hearts continue to go out to everybody in the healthcare field right now. We've got some great organizations, and you help to make us a better community and region. Thanks. Continue to do the great work that you're doing. Let us know how we can support.